Hello.
Hello. Y'all hear me okay so far?
I can hear you.
Great. Where are you, Armin?
Can you hear me?
Yes.
Uh, okay, great.
Long time no see.
Yes, it's been a while. Let me turn on my camera. All right.
Where are
How
you?
have you been?
I'm great. I've been great. Where are you?
I'm in Armenia now. I've been back since last August, but coming back to hopefully next month.
Okay, back to the States.
Coming back to Atlanta. Yeah.
Okay. Awesome. And you're doing a Fulbright out in Armenia?
No. I did Fulbright back in 2014 at the University of Missouri. And that is why I had to come back to Armenia because I had a home residence requirement. So the CDC couldn't keep me because of the visa regulations.
Okay.
So I had to come back, and then I got a waiver, and now coming back.
I see. Okay. So that's, yeah, that makes a lot of sense. Technical things. You have to do
Yeah,
things going back and forth.
yeah. hmm And everything took way longer because of the backlogs in the government, shortage of staff, like all
So,
the paperwork processing took way too long.
yeah. When were you there officially? When did you go during COVID or before COVID or after?
To Armenia,
Yeah.
or yeah, I moved back in August of last year, so kind of I
Okay.
guess middle of the pandemic or towards the end of the I don't know. It's still not the end, right?
No, I
It's
don't
still
even know
ongoing.
yet. We're just here. We're just all here.
Hi, Kakali and Chris.
Hello.
Hey.
Armin, can't wait for you to come back. And nice to meet you, Lauren and Chris. This entire time this discussion was going on, I was on the COVID response. And then I looked at it and I said, I don't need to speak because a lot of the data linkages are integrated into Armin's research. So why just, take the thunder away? Let him present it as he's presenting his research. So that's one of the reasons I said, I'll join if there are any questions that come up in terms of the broader plans or anything else. I can chime in the chat session or later. But Armin, you can cover it, right? Absolutely. There's no need
Yeah,
for
yeah. If there are any questions about the social
sorry.
vulnerability index or county health rankings, you might want to add
Yeah,
something.
and you might want to mention when you're talking about the county health rankings data and the other data where you pulled from, those were secondary data sets, but many of the metrics were coming from BRFS or from ACS. I think most of the
Mhm.
demographic data was coming from the American Community Survey and the other data was coming from BRFS. Hi, Chris and Lauren. Are you both sorry, I didn't get to, are you both at USDA?
Uh, I
Chris
am.
yeah, USDA.
And you are at Arizona State, Lauren?
I'm at Arizona State.
Yeah.
Yeah. I
So
do a
yes,
lot
and
of
what,
work USDA though. I
Lauren
do
and
a
I
lot of
actually
work with
had
it.
this.
Yeah.
same
Sorry,
advice.
Zoom is so awkward. So I got my PhD at Penn State and I graduated in 2017. My very first advisor in grad school though was Alessandro Bonanno, who was Armin's advisor. Alessandro left a couple years into my PhD, and then I switched advisors to Ted Janicki. Ted has worked with Andy, and I did an internship at USDA back in 2013 during the summer. And a part of my basically that's where I figured out what I was going to do for my dissertation. So like scanner data bonanza. So that's sort of like what I'm one of the early adopters of this info scan and all that stuff. So I've been integrating a lot of the data linkages work throughout the years, and so I'm excited for this panel and seeing more of what you're up to, because there's so many data products out there, and the partnerships with CDC kind of open a whole new area to link, especially Burfus and all that other data sets I have not really played around with much. But yeah, that's my little spiel.
So yeah, so that's great. Chris, how about you?
Well, I work on the linkages team with Andy. So I work a lot with like the purchase play crosswalk and stuff. I don't know. Been with USDA for about a year. Before that, I was at UW-Madison getting my master's in economics.
Terrific, terrific. So, it was just like almost fortuitous how Andy and we started working on this together. There was this like side interest from the Chronic Disease Center director on using scanner data because of what happened around e-cigarettes, and the tobacco division was using a lot of the scanner data on e-cigarette sales. And that's how we connected with Andy, and we started with a pilot. We thought, proposed a pilot, and then they approved bringing Armin, like bringing somebody on board. I like Andy's new, hi, Andy. And then Armin comes on board, and we got a few pilots done, like thanks to Armin and Andy. Those moved very quickly, and we are starting to deepen our collaboration with the Division of Physical Activity and Nutrition and other divisions.
Okay.
So Armin was just there for a year, and he had to, but he's coming back. Hopefully, we are expecting you back by September, Armin.
Yeah.
So did
Hi, can you guys hear me? Please give a thumb. Okay, that's working. Now I just need to hear you.
Can you hear us? Hello.
Hi, Andy.
Andy, did you hear that Armin's got his visa approved? So he should be, not visa, I think he still has an appointment waiting, but it was approved. So we are hoping to be back by September.
Work permit, yeah. The work permit was
approved.
I still need to get the receipt. I still need to get the hard
visa,
copy
right?
of that so that I can apply for it.
Oh, Armin's connection is, Armin, your connection's a little shaky. Is it my connection or is it your connection?
I think it's Armin's.
Okay.
So when you're presenting, Armin, if it gets shaky, one way out might be to switch off the video when you're presenting so that you don't have any interruptions.
Yeah.
Now you're good.
So I'm bummed because they double booked this exact session with the FSN White House conference, hunger, nutrition, hunger, nutrition, public health listening session. Yeah.
Wow. And you get I haven't got a link to that. If I had that, I would be joining that just to know what's going on.
Yeah. It's such a bummer. Such a bummer.
When does this actually start, the session?
In 20 or 19 minutes.
Oh, 19 minutes.
Yeah.
So this session is recorded, right? And then is it going to be posted somewhere or?
On the app. It's for people to go into the app and then
okay.
The AAEA app. Yeah. But it's recorded right now. So it's being recorded.
So do we broadcast on the website, or do people join this Zoom session to watch?
I believe there's two ways of doing it. You can go through the app or click the link and then join Zoom directly.
Oh, okay.
Hey folks, I still can't hear you. I wonder if anybody has suggestions. I've checked the speakers and they're the same as my audio. I've obviously left and come back. I wonder if anybody else has some suggestions. You're gonna have to put them in the chat. Okay, thanks. I'll dial in.
I don't think I told everyone hi. So hi, good morning, y'all.
Hello.
Hi, Alana.
Hi.
Lana, you're my favorite person because Nielsen still not getting back to me on these very important questions.
I know they take forever. Yes, but it's so good to finally put a face to the name.
Yeah, your girl. TD Links is my jam. Love that data. I wish it was a little bit better, but that is so good data set.
Okay, I'll be right back. I'm just gonna go over my slides. I just wrote up my notes last night, so I'll take a chance to go look at it now.
Andy, while we are waiting, as we are waiting,
Can't hear you.
Andy can't hear me.
Mm-mm. So that's why she's having issues with her. She's having issues with her speakers right now.
Wow.
So she has to call in, and she's just dialing on her phone. And you know how you can switch your phone on. You can switch your audio. Are you familiar with the Zoom? Yeah. So there you are.
Okay.
Can you hear us? You're on mute right now.
You're on mute right now.
Okay.
Can you hear us now?
Okay. Yes, I can. And I can
Great.
hear you.
Wow, that's awesome.
Yay.
Okay. Oh, yay, we have one person coming.
Yeah.
Joining.
So,
Have you guys tested sharing your slides? Lena, Chris,
was-
and Armin?
I was just about to try that. Okay, let me see.
By the way, I can't hear Andy well. I don't know if it's also because I can hear everyone else clearly, but Andy's voice seems to be from far away.
Is this better, Armin?
I think
Is
so.
this better, Armin?
Yeah.
yeah, when you
Is it
talk,
better? Okay.
when you're answering questions, Andy, just like maybe bring the speaker closer to your face. You know what I'm saying? Like bring it here.
Like
Yeah.
this?
Yes.
Like this? Okay, thank you. Hopefully, Chris will be able to answer all the questions.
Yeah.
That's the plan.
Alana, we can see your slides.
Okay, perfect. Okay. Y'all are, you see the slides, not the like, I know sometimes I have trouble with the screen. Sometimes it comes up like with the note one. I just want to make sure it's just the PowerPoint slide,
Just
right?
the PowerPoint slides. Mhm.
Perfect. Okay, thank you.
And yeah, if you're sharing slides and the wrong screen is being shared, you can either switch the screen or you can go into PowerPoint and then click swap presenter view, something like swap something. So that way the right screen will be showing to everybody else instead of your note slide.
Okay, thank you.
But you're good. We saw whatever you did, don't change a thing, Alana.
Okay.
Okay. Armin, I saw in the comments that your connection is shaky. Do you maybe want to send your slides to Kakoli, or maybe she already has them?
I sent the slides to Lauren. I can share it with everyone on the
With
thread.
Lauren's
Just-
great. So in
Yeah, I've
case
got
of
them
a
here.
problem, Lauren can share it. Yeah.
Okay. And Chris, did you want to practice?
Yeah, you mean practice sharing it on the screen?
Yeah.
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 Maybe I need to, are you guys in a Zoom app or a web app? I don't see share.
We're on the computer. I'm on the computer.
Oh wait, never mind, it's right in the middle. I completely missed that. Okay, do you see that?
Yes, you're in just the desktop version, and we can see the thumb tiles on the left side, and then your full screen on the right, like 3/4 of the page. Is that
Okay.
what screen you want to share?
Yeah.
Actually, Chris, I think you want to share the presenter mode.
Yeah, where is that? I haven't done a
Up at the, oh yeah, that's what I was thinking. Up at the top on that black bar, there's a little thing that looks like a little TV. It's the second from the left, that one. Click on that.
Okay. Well, that goes to my other screen.
That's okay. So then now you're going to click display settings. Oh, click that again. Display settings. Swap presenter view and slideshow.
Okay.
Now you're showing the correct slide.
All right. Great.
Excellent.
Let me try this too, just to make
Okay.
sure everything
I'm gonna-
works.
I'm going to send an email to AAEA and let them know that we managed to get in.
Great. Thank you, Andy.
Let me see if give me one more shot here. I just want to see if I stick my notes to the right of that, if those will show up. Okay, so do you just see the slides right now?
Yes.
Okay, good.
And then we're going to have Armin share his slides next. So whenever you're ready, Chris, and you want to end your share screen, that would be great.
All right. Okay, I'm trying. Zoom is in that smaller window. Do you know how to get it in the bigger one? Where you have all.
You're going to hover over the, there's like probably at the top of your screen, there's going to be your viewing and then, or you're sharing something in green, like a green bar, and then it says view options. There you go.
Yeah, I got it. Thanks.
Okay. What did you do? So just in case everybody else will find that helpful.
It was just at the top of the screen, like you said, top center, green bar.
Great. And Armin, I see you're sharing your screen.
Can you see this? Can you see the slides?
Yes.
Okay.
Super. My turn.
I know Armin needs to keep his off because of a shaky connection, but I'm wondering, certainly during the connection, if we can keep cameras on during the discussion part, if people are comfortable with that.
Yeah, sounds good.
Okay. Oh, and if you can keep your camera on when you're actually presenting, that would be great.
Do you see? Thumbs up. Good.
So the only thing I suggested was like Armin's connection was very unstable. So if that continues to be when he's speaking, it might be easier if he switches on the camera because like if needed.
Yeah, that's what I was saying. Armin may have to keep camera off. And maybe we can, Lauren, you can just make a statement that we're having a faulty internet connection.
So what I'm gonna do is basically, like I'll say at the end of my 8 minutes or so that I'm done, and then Alana just call you up. I'm gonna end my screen share, and then you'll just pass it on to Chris, and then Chris, you'll pass it on to Armin, so that I don't have to interject and then disrupt the flow.
All right.
Okie
sounds good.
dokie.
Thank you. And meanwhile, Andy, I'm gonna be documenting questions that we get in, whoever's here. And then I'm also gonna be taking notes so that I can be ready and armed with questions for the team.
Oh, that is extremely helpful. Yes, great monitoring. Yeah, I was gonna say, so right now we have one person, and maybe after the meeting, we can also talk about a platform to redo this, because everybody made all these, to redo this on our own.
Yeah, absolutely. We can host it at ASU too. We can do part of our seminar series or something like that. So happy to support it. Mm-hmm.
And yeah, we have the list of people who said they wanted to come in the AAEA app, so we can do that. And Wei, thank you so much for joining us.
And Andy, Drew is representing DIFA at the FSN meeting right now. So he can't be here, but he's there.
Yeah, I figure as those of us at USDA are going to be doing staff analysis related to that thing, and probably CDC as well. So we'll weigh in other ways.
Yeah. I sent them a blurb about our project. Get started in 1 minute. Okay. So time is 9 Pacific, which means 11 Central, 12 Eastern. I did that right. Okay, great. So welcome everybody. We are here for a seminar post AAEA seminar webinar on linking data for research in public health and nutrition research. We're going to be joined today by several very interesting researchers doing interesting projects around that topic. I'm Lauren Cheneritas. I'm an assistant professor at Arizona State University. I'll be serving as your moderator and discussant today. Then we're also joined by Alana Roan, who's at the USDA Economic Research Service, Chris Lowe, also at the Economic Research Service, Armin, and I'm not going to even try to pronounce your last name, who is joining us from the Centers for Disease Control and Prevention. And then Andy Carlson at ERS. She is our organizer and also will be serving as a moderator and discussing today. All right, so before we get started, I wanted to, because I'm sitting here kind of teeing us up, I wanted to bring up some important legislation and conversations that have been happening in the policy sector to provide some background and context. So there are two really important pieces of documentation that have been published in the last 3 years or so. And both of these reports call to mind this idea of evidence-based policymaking. And so what does that actually mean? Really what these reports are calling attention to is this notion that there's all this data available, and these data are being funded by different policy organizations and governing bodies within the United States. And we are collecting all of this data, and what these reports are really promoting is more efficient use of that data. In large part, using that data efficiently requires linking existing data sets together. And at the core of this all is this return on investment. So there's all this investment in resources to collect all this information, and there's a reason to spend more time increasing our utilization of these data sets so that we can not only make it more efficient, but also think about more creative ways to answer longstanding research questions. And here are two excerpts from a couple of these reports that listed here, and you can just see that overtone is really embedded throughout these two reports. So to respond to the call, researchers should be aware of the following opportunities: that policy-based research in food and agriculture requires comprehensive analysis using contextual, econometric, and disciplinary knowledge. It requires integrating disparate data so that researchers have more complete information about the markets they study, the potential need for policy, and the intended and unintended impacts of suggested policies. And really today, we're going to be highlighting this idea of data linkages, that they're really unavoidable for some of the cutting edge research that's being called upon all of us, given the current needs of our society today. Here is another excerpt that I wanted to call out from the National Academy's report. It says here that the case for expanded and better coordinated use of valuable administrative data such as those that reside within federal, state, and local governments, is especially clear for purposes of program monitoring, evaluation, and improvement. This value is enhanced when the administrative records can be linked to data on the population of program eligibles, such as from sources as the American Community Survey. And this is just an example, but really it's to me demonstrating the need to make a more strong case for linking data to answer some of these longstanding questions. And obviously, in order to answer this call, there are going to be some barriers, and today we're going to walk through. We're going to have 3 really excellent presentations describing how they've overcome some of those barriers. And here I've just articulated a few of those. Often, I myself, as a researcher who does a lot of data linkages, have encountered these in various ways. Whether it's where do I find the appropriate data, which data can be linked, how do I even access the data? Some of it's private, some of it's public, some have certain identifiers that others don't, and then actually implementing the data linkages. And we'll get into a lot of these today. So by the end of this workshop, we want to ultimately spark your interest in using our linked data for policy informing research. And we're joined by several representatives from the Economic Research Service, which is in large part a key player in providing data to researchers in the ag and applied economics space. We're going to cover topics such as food environment and food availability. We're going to look into linking scanner data with nutrition and health data, and we'll give you some example applications. And we'll leave some time at the end to conclude and answer some of your questions that come up. So why the topic of public health and nutrition? Well, I'll give you some key stats here. Well, first of all, 6 in 10 adults have at least one preventable chronic disease, and these are linked with poor dietary quality. And the overarching research question that drives a lot of the research that the ERS puts out, Centers for Disease Control, and many of you who are interested here today attending this session, this question of why do some consumers make healthy food choices while others make less healthy food choices? And there are many explanations for this. It could be food costs, poverty, food availability, the food environment, cultural preferences, availability to healthcare, lack of time, skills, or knowledge. And many of you have even published research looking at these explanations. So which ones are the strongest? In order to actually identify which of these drivers of food choice is the strongest, we can and we do use various data sources. Here are just several of the ones that we're going to be covering today. And maybe some of you are aware of them and maybe not. So I'm excited to hear our presenters go into how they were able to identify some of those drivers of food choices using these data sets. And then also this another data product on the food environment will be looked at in depth today. And then also the scanner data. So the first set is CDC data products. The second set is in food environment data from the ERS. And then scanner data is the third bullet here, which is offered through a partnership with the Economic Research Service. All right, and just to kind of tee us up, we're going to be covering all these topics through 3 presentations. We're going to hear from Alana Roan, Chris Lowe, and Armin. And then again, at the end, we'll have some time to answer questions from the audience. Please make sure to submit your questions in the chat box. I'll be monitoring them, and I look forward to all these presentations. So Alana, I'm gonna stop my screen share and I'll let you take over.
Thank you, Lauren. Again, I am Elena Roan. I'm an agricultural economist within the USDA Economic Research Service, And I have the great pleasure today to speak to you on linking to food environment data. Linking to food environment data is important because some individuals' diets are out of balance with dietary guidelines. Some individuals may lack access to nutritious and affordable foods. ERS found that in 2019, limited food access to a food store impacts between 11 to 27% of the US population. And the larger food environments may influence food choices and diet quality. A few of the questions that we ask ourselves are things such as how many people have limited access to healthy and affordable foods, and how does food store access in the larger food environment impact food choices, diet quality, and diet-related health. Lauren mentioned that ERS has several, we have several resources available to assist the public in looking at food access in the food environments. I will be specifically going over two of those today, the Food Access Research Atlas and the Food Environment Atlas. They have both been used in research looking at adverse health outcomes in patients residing in low income and low access areas within the United States. They have also been used to investigate the effect of food environments characterized as food swamps on adult obesity rates. And it was also used in a paper that my colleague Armin will go over shortly that examines associations between household retail food purchases and the county level food retail environment. To help understand how many people and communities may be affected by limited food store access, ERS created a mapping tool and the data set within it, and we called it the Food Access Research Atlas. It presents a spatial overview of food access indicators for low income and other census tracts using different measures of supermarket accessibility. And it provides food access data for populations within census tracts, such as age, race, and ethnicity, and SNAP participation, just to name a few. And it also includes 4 different measures of low income and low access census tracts. The Food Access Research Atlas provides maps and data that can be viewed, downloaded, or printed, and it offers census tract level data on food access indicators that can be downloaded for government, community planning, or research purposes. This slide just shows some recent national estimates of low-income and low-access census tracts that came from the Food Access Research Atlas. I'll just go over one in particular. And so one selected finding from the Food Access Research Atlas found that 33.2% of low-income individuals lived more than 1 mile from the nearest food store. The next mapping tool that I am going to go over is the Food Environment Atlas. The Atlas assembles statistics on food environment indicators to stimulate research on food choices and diet quality. And it also provides a spatial overview of a community's ability to access healthy food and its success in doing so. Currently, the Atlas includes over 280 indicators of the food environment. So we have a lot of data for you to pull and use for your own research. The year and geographic level of the indicators vary to better accommodate data from a variety of sources. Some indicators are at the county level, while others are at the state level. And we try to use the most recent county level data whenever possible. However, they do cover varying years. The Atlas assembles statistics on 3 broad categories of the food environment: The first one being food choices. So indicators of a community's ability to access and acquisition of healthy and affordable food. So this includes things such as the number of food stores, convenience stores, shopping centers, food and nutrition assistance program participation information, and also the availability of local foods. So we have information in there on food banks and food hubs and farmers markets. The next category is health and well-being. These are indicators of a community's success in maintaining healthy diets. And lastly, the third category is community characteristics. These are characteristics that might influence the food environment, such as demographic composition and income and poverty. This is just a statistic and map that was pulled directly from the Food Environment Atlas, and it looks at farmers markets that report credit card acceptance by county in 2018. And one of the findings was in 2018, 72% of US counties reported having at least one farmers markets, and more than half of US counties had at least one farmers markets that accepted credit cards in 2018. So that's just one indicator that you can pull. And as I mentioned before, we have several in there that can be used and downloaded for your research purposes. To use the Food Access Research Atlas and Food Environment Atlas data in your research, we have included census tract level FIPS code, which is an 11-digit FIPS code, and county, that's for the Food Access Research Atlas, and county level FIPS codes, which is a 5-digit number that for the Food Environment Atlas. These can be, found in our downloadable Excel spreadsheet that can be found on the ERS website. So these FIPS codes that are found in the Food Access Research Atlas and the Food Environment Atlas can be easily merged or joined to other data sets. And you can also match the census tract FIPS and county FIPS to zip codes as well. So this includes my presentation. If you would like my information, my contact information is on this slide, and you can reach out at any time, and I am happy to help. At this time, I would now like to pass the mic over to my colleague, Chris.
All right. I'm sorry, can you see the presentation, everyone?
Your screen,
Actually, Chris,
you're just gonna want to press that little icon on the top.
Are the Zoom icon or the
slideshow presenter? Yeah, so you're gonna go to the top bar above design, click that. And then, okay, so then probably click slideshow. Resume slideshow.
Yeah, let me try something different real quick. Yeah, I don't know what's happening now.
Okay, so here's another thing, Chris.
Yeah.
So you're gonna look at your screen and you see the main screen that you have, the main slide. Underneath it, on the bottom toolbar, you're gonna see a bunch of things. And you're gonna go to the left of the minus sign, there's another button, click on that.
Slideshow.
Yep.
Okay.
Do you see anything? Did anything happen?
Just the same thing.
Okay. So what's happening is I think you never closed out of your other PowerPoint when your presentation. So do you see on your second screen a bigger slide of what you want to present?
No, I just have the one.
Just the one. would you mind just walking us through maybe minimizing the tiles on the left, or you wanted your speaker notes?
Yeah, I'll just minimize, that works. All right, so hello everyone, my name is Chris Lau. I'm an agricultural economist at ERS, and I primarily work on the linkages team, where we link IRI grocery scanner data with USDA nutrition databases. And I'll be covering the purchase to play crosswalk, which provides those linkages. So the IRI grocery scanner data has two sales sources. One is the retail data, straight from retail stores, and this has coverage of about 20% of stores with about 50% of grocery sales in the United States. The other source is the consumer network, where participating households report their grocery purchases mostly by using an app or scanning the groceries themselves. Grocery and related industries use this data primarily for market research, but USDA uses this for research that can include external collaborators. The research includes program evaluations, regulatory impact analysis, and data products. So next up, we have the Iri Info Scan, which is the retail data. And this has coverage from about 2008 to 2020. The data is reported weekly. So each store or marketing area reports their total sales in dollars and units. And from this, you can also derive prices. There exists roughly 60,000 participating stores in Iri Info Scan, and this captures about 8 billion in sales per year. There are a variety of participating store types beyond just grocery stores, and this includes sales clubs, supercenters, convenience stores, dollar stores, drug stores, and military commissary stores. Accompanying all this data, sales data, is a product dictionary that gives detailed information on each product sold. Additionally, we have household scanner data, which includes about 120,000 households, with around 60,000 of these households occurring in multiple years. The data collection is a joint venture between IRI and Nielsen, and households participate by scanning their grocery purchases at home. The IRI consumer network includes demographic data for each of these households and is also accompanied by health and prescription drug survey data. Just like InfoScan, detailed product information is covered for many of these products reported in this data set. So this brings us to the purchase to play crosswalk, which is a USDA data product that provides links of the retail foods found in IRI scanner data with foods in the USDA nutrition databases. And there's two primary benefits that result from this linkage. The first being users can import detailed nutrition data to the scanner data. And this allows users to calculate HEI scores for collections of goods in the IRI retail scanner data. So an HEI score is a measure of compliance with the US dietary guidelines for Americans, and it's a score from 0 to 100. And there's 13 component scores that measure things like fruit, vegetable, and protein consumption. And the purchase to play crosswalk is just the genesis for the purchase to play suite. And this includes 4 data products. The crosswalk, being one of these, also includes sample code that assists users in importing USDA nutrition data and calculating HEI scores from within the IRI InfoScan and consumer network data sets. Additionally, we have the purchase to play price tool, which you can use to estimate prices for food items found in NHANES What We Eat in America survey. We also have the ingredient tool, which complements the price tool by providing estimates for purchase weight and associated cost for ingredients in the food items in the What We Eat in America survey. And we also have forthcoming, we have the purchase to play national average prices, which is the result of the purchase to play price tool. And these provide the prices for the NHANES What We Eat in America survey. And that is all I have. Next up, we have Armin.
Thank you, Chris. Let me share my presentation. Can you see the presentation? right. So thanks, Lauren, Alana, and Chris for the presentations, and thanks everyone for attending. I'm Armin Gazarian. This work was done during my time at the CDC, Centers for Disease Control and Prevention. Before I start the presentation, I need to say that the findings and conclusions in these studies that I'll be presenting are those of the authors, and they do not necessarily represent the official position of the CDC, USDA, or US government determination or policy. They should also not be attributed to the IRI. So I'll quickly go over the background of why we're asking these questions. Chris already talked about the healthy eating index, so I'll skip that, and then I'll show you some applications of the linkages of data sources. As Lauren already mentioned, there are high rates of obesity, for example, and diet-related illnesses, including cardiovascular disease and type 2 diabetes, are some of the major public health concerns. And many communities in the US do not have access to affordable, nutritious food, and studies show that lower income communities, communities of color, or rural communities are less likely to have healthier food available to them. So we're trying to understand whether community level, county level indicators explain indicators of socioeconomic characteristics, retail environment characteristics can explain some of the differences in food purchase quality. So for those of you who don't know what the AGI is, it's a diet quality measure, and it consists of the 2015 version, which is the latest iteration, consists of 13 dietary components. Some are adequacy measures, others are moderation, meaning that, for example, someone consuming an equivalent of 0.8 cups per 1,000 kilocalories of total fruits will receive a maximum point for total fruits component, and someone consuming no fruit or purchasing no fruit will receive a score of 0 for this component. Similarly, for moderation components, someone who receives more than 26% of energy from added sugars will receive a score of 0 on this component, and someone who consumes or purchases less than 6.5% of energy will receive a maximum score of 10. So in the first study, which is authored with my co-authors, Andy, Alana, and Kakali, we examined the association between nutritional quality of household food purchases, which is measured by the AGI 2015 and its components, and the association between household income, underlying chronic diseases such as type 2 diabetes, cardiovascular diseases, and risk factors such as smoking and obesity. So here for the first part, we used the IRI consumer network data. We used the static panel, which is a national representative panel of households. We merged it with the USDA nutrition data via purchase to plate crosswalk, which Chris just mentioned. And then for the second part, for chronic diseases and risk factors, we use the IRI Met Profiler data, which is an underutilized data source, and it can answer many questions that are in the interest of public health and also economists. Met Profiler is a subset of the consumer network data. It's an annual opt-in survey, and it consists of about 30,000 households where at least one member responded to the survey. IRI has assigned weights to make the sample national representative. So in the Met Profiler data, the respondents have 5 options, 5 possible responses to health questions, such as suffer but do not treat from a certain condition, suffer and treat with prescription, with over-the-counter medication, or both prescription and over-the-counter medications, or simply do not suffer. So for those households where at least one person indicated that they suffer from any of the conditions included in the study, we made a binary indicator, taking a value of 1 if they suffer and 0 if they do not suffer. And for the smoking indicator, if someone in the household over the age of 21 reported smoking, then we included them as smokers. The methods, I won't go into the details because the focus is the data linkages and the applications, but we basically did regression analysis to estimate the adjusted AGI score. We stratified it by household income, such as at or below 130% of poverty, between 130 and 185% of poverty, and above 185% of poverty. We also stratified data by health outcomes and risk factors, such as cardiovascular diseases, type 2 diabetes, obesity, all three conditions combined, or smoking. Here is a summary statistics of our sample, just to give you an idea of what the sample looks like. So about 14% of the sample had someone who reported type 2 diabetes, 42% had cardiovascular disease, and so on. So here we looked at the component scores by household income. And what we see is that higher income households, those above 185% of income of federal poverty line, they scored higher on almost every component except for fatty acids and saturated fat. The differences, although they're small, they were all statistically significant except for one of the scores. Next, we looked at the HR score differences between households who had someone with one of these health risk factors. So, for example, households who had a member with type 2 diabetes, they scored lower than those households where no one reported type 2 diabetes. And the same applied to all the other health risk factors. The largest difference that we observed was among households who had a smoker and households who did not have anyone who reported smoking. So the highest difference in AGI score was observed in this between these two groups. Next, we looked at the AGI component scores to understand where exactly the variation comes from. And I've highlighted the major differences by types of households. So for example, in this column, we see households where no one reported having type 2 diabetes versus those who reported, where at least someone reported having type 2 diabetes. The major differences we observed for the total fruits component, whole grains component, and sodium. But interestingly, we also found that households with type 2 diabetes scored higher on the added sugar component, meaning that they conformed with the dietary guidelines for Americans better than households where no one reported having type 2 diabetes. While at the same time, they scored lower on pretty much every other subcomponent, including total fruits and whole fruits. Then over here on the right side, we did the same for households with and without a member with cardiovascular disease. Again, the largest difference between the two groups was observed for total fruits, and whole grains components. We did the same thing for obesity and then combined conditions, meaning obesity, cardiovascular diseases, and type 2 diabetes, and smoking. And then the main conclusions from this study is that overall, the US retail food purchase quality was low. So as Chris mentioned, the highest score on AGI is 100. In our sample, the average score is about 52, 54. So it's still very low, but it's especially lower for lower income households with at least one reported health condition, and especially those where someone reported smoking. So the fact that households with at least one member reporting type 2 diabetes followed the added sugar and total vegetable guidelines more closely than those without a member with type 2 diabetes, and the fact that households with a member with type 2 diabetes scored lower on total fruit and whole fruit components suggests that these households are probably avoiding purchasing fruits to not increase the sugar levels in blood, which is not really consistent with the health recommendations. Or in other words, natural fruits do not really have the same negative impact as added sugars. And then the contributions is that unlike self-reported dietary recall and food frequency questionnaire data, which is what a lot of these type of studies are based on, data in this study is recorded throughout the year. So consumer network data is recorded throughout the year, potentially reflecting more realistic food purchases. And we also included multiple health risk factors in this study, which many of the previous studies have only focused on one or two risk factors. Things that we need to keep in mind is that the consumer network data does not record food away from home purchases, and only helpfulness of food purchases is captured but not intake, meaning that we only observe what was purchased, which does not always translate into consumption. Some of the purchased food may be wasted. And then in the next study, we looked at the association between county-level food retail and socioeconomic environment and the nutritional quality of household food purchases. It's authored with the same co-authors, Andy, Elena, and Kakuli. So our objective was to examine the associations between the nutritional quality of household retail food purchases and county-level food retail environment, county-level demographic, health, and socioeconomic indicators, as well as household composition, demographics, and socioeconomic factors. So here, what we did is that we used the IRI consumer network data from 2015. We merged it with the USDA nutrition databases via purchase-to-plate crosswalk, and then we obtained county-level racial and ethnic composition, rurality, poor mental and physical healthy days, and obesity prevalence indicators from the 2020 county health rankings. And then we also merged some of the indicators from the Food Environment Atlas, which Alana presented earlier. Particularly, we included the density of grocery, convenience, specialty stores, supercenters, fast food, and full-service restaurants, as well as farmers markets. And these are county-level indicators. So we examined the association between the AGI and those indicators. We stratified the sample by household income categories as well as county rurality. And the main results is that, so keep in mind that the dependent variable is the healthy eating index. The main results suggest that county level food retail environment indicators were not really associated with household level food purchase quality. There were some statistically significant indicators such as convenience stores, the number of convenience stores, and specialty stores. So when we look at the full sample, we see that the number of convenience stores was negatively associated with household level food purchase quality, while specialty stores were positively correlated with, had a positive association with household food purchase quality. However, when we stratified the sample by household income, we saw that the difference, that the impact was only statistically significant for households above 185% of federal poverty line, and the impact of specialty stores was only statistically significant for those below the federal 185% of federal poverty line. Then we looked at the poor mental health days, and we see that for households, for higher income households residing in counties with higher number of poor mental health days, those households had lower AGI scores. Similarly, higher income households who resided in counties with higher adult obesity also had lower AGI scores. And county rurality was also associated with lower AGI scores. And this was true for both higher income and lower income households. And then we stratified the data by county rurality, and we saw that the only difference was the only statistically significant association was for convenience stores for households residing in urban counties, meaning that households residing in urban counties with higher number of convenience stores had lower AGI scores. We saw a lot of statistically significant variables that are at the household level. So for example, household head's age was positively associated, and this was true for both income levels. Household head's education was also positively associated with household AGI, suggesting that the higher the household head's education level, the higher the household's AGI score. This held true when stratified by rurality of households' residents. And the key findings is that associations between the AGI 2015 and county retail environment measures were generally not statistically significant. The AGI scores were higher if household heads had higher education. We also found that compared to non-Hispanic white primary shoppers, the AGI scores were higher for non-Hispanic Asian and non-Hispanic Black primary shoppers. This, when stratified by income, the AGI differences by race and ethnicity were only statistically significant for those above 185% of poverty. And when stratified by county rurality, the differences by race and ethnicity were only statistically significant for households in urban counties. So what are the contributions of this study? First is that we included county level and not neighborhood level food retail environment indicators, which is many of the studies have done in the literature. And potentially we're capturing the fact that households may not shop at stores in their immediate neighborhoods, but potentially further away from their homes. Also, we used, again, household food scanner data, which potentially captures a more realistic food purchase picture. And compared to previous studies that focus on one or several food groups and ingredients, such as fruit and vegetable consumption or added sugars, we use the AGI measure, which incorporates 13 dietary components. Here are some of the limitations, which I'll skip for now because of the time limitations, so that I can also briefly talk about what we did in the third study. In the third study, which is also co-authored by two more authors from the CDC, in addition to our USDA and CDC co-authors. So in here, we're looking at the differences in sugar-sweetened beverages and bottled water purchasing according to both household level characteristics as well as area level characteristics, and estimate expenditure on SSBs and bottled water among a nationally representative sample of US households. So as you have already seen this data source, IRI consumer network data, we used again the same data. We got the added sugar content from the USDA's purchase to plate crosswalk data. And then we merged this with households county level poverty prevalence, which was obtained from CDC's Social Vulnerability Index, as well as census tract level child opportunity index, which measures conditions and resources that are conducive to healthy child development. Our outcome variables are annual per capita expenditure on SSBs, daily per capita total SSB calories purchased, and annual per capita expenditure on bottled water. The main results is that 95% of households purchased sugar-sweetened beverages at least once during 2015, and 70% reported purchasing bottled water. On average, they spent $46 per person on sugar-sweetened beverages and $11 on bottled water. We found that the highest sugar sweetened and bottled water expenditure among households headed by middle-aged, single, no high school diploma, and non-Hispanic adult plates were among these groups, and also low-income households, households with no children, households residing in low-income counties, as well as those who resided in South or in very low child opportunity index census tracts. I will skip the detailed discussion and the results here. So the main findings is that disadvantaged and minority populations had higher expenditure on sugar-sweetened beverages and also bottled water, and they also purchased higher calorie sugar-sweetened beverages. Studies show that tap water avoidance is associated with higher bottled water and sugar-sweetened beverages, and we need to keep in mind that the data was from 2015, which is when the Flint water crisis was taking place. So potentially disadvantaged and minority populations, which is also representative of the Flint community, they distrust tap water safety more often than their counterparts. And as a result, they purchase more bottled water and sugar-sweetened beverages. Media coverage of tap water quality violations may have also raised concerns in other communities, meaning in communities other than those that are directly affected. So I think I'll conclude here, and thank you for your attention and for joining this session. If you have any questions, here's my email. Feel free to send them my way.
Excellent.
Lauren?
Everybody. Thank you. So interesting, everyone's presentation. So I suppose I'll kick off with some questions and then let everybody else catch up and see if they have any other questions they want to add to the chat box. I saw one come in, and I'm gonna go in the order of operations of presenters. So maybe the presenters can just show their screen or show their faces and unblock their view, just so that we have everybody who's been presented. So Alana, Chris, and Armin, if you have the bandwidth, Armin. Okay, so Alana, first question for you. I will just, let's see, which one do I want to pick? So the Food Environment Atlas and the Food Access Research Atlas, you presented them in the order of the Food Access Research Atlas, followed by the Food Environment Atlas. And the Food Access Research Atlas is down to the FIPS, the 11-digit FIPS, and then the Food Environment has the 5-digit county level. And so my question to you is more regarding first the Food Access Research Atlas. And I suppose for that one, it's more of a question of if you could improve one thing about the Food Access Research Atlas, what would that be? And the reason why I'm asking you this question to have you think of an answer, to stall a little bit. The reason why I'm asking that is because I know that one of the limitations of that data product is that it's collected not annually. You know, it's created not, you know, it's every, you know, every so often. Yeah, the having that granular measure of the 11-digit FIPS provides really important information at understanding the geographic heterogeneity of access to food retailers, which is really important for researchers who are interested in some of the more spatial components when we look at interactions between our food environment and food choice. So again, my question to you is if you could improve one thing about the Food Access Research Atlas, what would it be? And then maybe in order to accomplish that, what would be required? You know, because obviously we have a goal, we have a vision. So maybe as an inspiration to all of us on the call, maybe it would, you know, inspire us to help accomplish that goal. What do you think?
Yeah, you really bring up some great, some valid points. One thing, well, I think it is a good tool on its own. However, there are some things that can be tweaked. You mentioned one thing in particular about possibly having annual data. Right now, we try to update the Food Access Research Atlas every 4 to 5 years. And that's sometimes because of there may not be a lot of change if you do it, from year to year between census tract changes. So this allows for more nuanced like analysis, because there may be a bigger change doing it every 4 to 5 years. Also, for the Food Access Research Atlas, we used Euclidean Distance, and this is just geographers kind of use this, and it's a straight line distance from where people live to the nearest grocery store. However, that only tells a part of the story, because again, it's just a straight line distance. It doesn't take into account streets, the ways that people actually use to get to the nearest grocery store. So we are incorporating that in the next version of the atlas, is we're going towards a network distance. So we're going to use that, which takes into account overpasses and other streets and tollways and things like that. So that's one way that we can that we are improving on the atlas.
Those are great comments. Thank you, Alana. And I very much appreciate it. Does anyone have any other questions on the Food Access Research Atlas or the FEA before I switch over to Chris? Okay, great. So Chris, my question for you, the What We Eat in America, WWEIA, that is correct me, so that's a product from NHANES, or that's something that's collected through NHANES, is that right?
Yeah, it's a specific part of NHANES, and it includes two 24-hour recalls for the participants on their diet. So they basically just say, hey, I ate this in the last 24 hours. And that is processed into the USDA nutrition data sets, which into very specific, general foods like, grilled chicken, stuff like that.
Okay, and does it indicate where the food was consumed, or where it was acquired and then where it was eaten?
Yeah, it does.
It does. Okay. Is it possible? So my question is, it's a yes or no question, but I'm hoping you can also give an explanation. Is it possible to compare the price for the same product, whether it was purchased whether it was purchased and eaten at home or purchased and eaten outside the home, like say in 24 hours, someone really likes chicken, I don't know, and they ate chicken at home, they got it at the grocery store, and they also went out to a restaurant and ate chicken. Is it possible to compare the prices for that same product at a higher category, at least, where it was eaten? And if so, what does that tell you, or what have you found? And if not, what would be required, or is it even possible to do something like that?
So I can tell you what I know for sure. And our data products provide prices for the food at home. So they're based on grocery store data. The food away from home, we don't provide prices for that using our purchase to play data products. I don't know, Andy, if you have anything to add to that.
The way to get food away from home prices is we basically need data for that. The food away from home data are very elusive. So if you know a source of prices for food away from home, please let us know.
Is that something that the USDA is interested in looking at?
Christy, you want to start?
Well, I would say definitely.
Yes.
NPD.
Yeah.
The NPD data products, I know that they were just, I think Nielsen just purchased some NPD affiliate.
Yeah, I believe we have NPD and researchers are looking on it. I do not know if that has individual foods in it, or how the breakdown is, or even if we can assign like food groups and stuff to it. And Elena, maybe you remember, have you worked with those data?
I haven't.
It's hard. Yeah, I know a couple of researchers at Cornell who are doing some work on food away from home, and it's so hard to find data on prices for food away from home, just because it's how do you record it, and then how do you code it all up, and then you don't know what the unit price is because you don't know how much people are eating, that's just, or how much the serving is, and it can be really tricky.
Now we just did our field test for the next round of food apps, and that of course will have prices paid by the consumers. So food apps round 2, and of course food apps round 1 has that information, though it was collected in 2011 and 2012. So stay tuned. We will have a data set that has food purchase and acquisition data.
Awesome. Okay, the next is for Armin. I guess kudos to all of you. Those were 3 very interesting studies, definitely valuable to the academy as a whole, and all these questions that we're always asking. So the first one, I was a little, and forgive me, so I would just like a little more clarification about one of the interpretations from study 1, when you were presenting what actually looks like is table 4 in the nutrients paper. You had shown that added sugar, you had said something that the added sugar was lower for the households with type 2 diabetic in the household, but I saw a number 5.3, which is greater than the number in the left column where there was no diabetes. This is table 4, which is 4.94. And I'm not sure how to interpret that. Could you just?
All right, let me go back to that study real quick. So,
while you're pulling it up, there was definitely fruits, whole grains, sodium. That's lower than the non-addictive. Yeah, that one.
Yeah, so what I said is that households where at least one member reported having type 2 diabetes, they scored higher on the added sugar component, meaning that they complied better with the dietary guidelines for Americans on this component, compared to households where no one reported having type 2 diabetes. While for total fruits, whole fruits, and pretty much every other component, households where someone had type 2 diabetes scored lower than households.
So it has
with no member with type 2 diabetes.
Score. Got it. Okay, that makes a lot more sense. Which then corresponds with a question that Andy raised in the chat box, which is regarding this idea of if the type 2 diabetic needs to reduce all sugars. Is that, so your interpretation then, I guess it's more of a, is this where your logic, or Andy, you want to chime in?
Yeah, so what we said in the paper, and this paper was published over a year ago, and Armin has had a lot of things happen in his life since then, so it's reasonable that he forgot. The issue with fruits, you notice that the score is lower for the type 2 diabetics. And that is actually a good thing, because diabetics should consume less sugar of any type, not just added sugar. The danger of added sugar is that it doesn't carry nutrients with it. So we generally say, okay, and the ATI score is indeed designed for a healthy diet, not necessarily for a diabetic, for someone with type 2 diabetes. So this is actually a good thing that they are purchasing less fruit because they're consuming less sugar overall. So that for the pancreas, a fructose, lactose, straight added sugar, and all the other chemicals, all the other things that contribute to sugars, those are all bad. You need to produce insulin for that. but the fruits do carry nutrients, but diabetics are encouraged to get those nutrients through lower sweetened or vegetables with less sugars.
That's an interesting point that you say that HEI is designed for a healthy diet, not for a diabetic. But there are other nutrition programs or nutrient suggested programs, dietary programs like the DASH diet and things like that for diabetics, I believe. I'm not a nutritionist, so but I have seen that there are different frameworks that are promoted to people who might be diagnosed with a chronic condition like diabetes and DASH. I don't know how different, or if people have looked into that, or how different an HEI is to a DASH diet, things like that.
Yeah, they are different. And it's just for that reason. Kakola, you had a comment in the chat too.
Yeah, so one of the things I wanted to add was, I think it's a plus that added sugar consumption is less among households with diabetes, where a member has diabetes. But not to forget, when we are looking at purchasing patterns, it's for the entire household. So when we are starting to see, lesser conformity with, say, fruits, which, that also carries sugar, it may not directly be consumed by a member who has diabetes. So there could be children in the households or others for whom, whole fruits are being consumed, whereas they seem to be avoiding purchasing products which have added sugar. So it's, the consumption by the individual member who's diabetic is not totally captured by household purchase patterns. And then your other question about, the DASH diet, in this particular paper, we really wanted to utilize the med profiler component of the consumer, the profile data, consumer network data. So we did not want to specifically focus on specific, DASH diets or whatever, Mediterranean diet or what have you, but look at HEI broadly across all conditions.
That makes a lot of sense. Thank you, everybody.
Yeah.
That's really, quite fascinating. And the other thing that, I think about more from like a food retailing side, Andy, one second too, is that like, I did notice that the, was there vegetables? No, it was just whole food, total foods. Total vegetables was even higher compliance, which was kind of interesting to see because maybe somewhat unexpected, because when grocery stores plan where their fruits and vegetables are often in the same section. So if a household with someone who's diabetic is actively avoiding added sugars in general, whether they're added or not, maybe they're less likely to go to the produce section. But we're not necessarily seeing that in the household, in the data here, in the results table here, that they would be active, because we're seeing that they're complying more with total vegetables. So I don't really, I didn't read the paper yet, but that's something that I was wondering about.
Yeah, something else that when I was playing with the HEI and looking at things, one of the things, and I haven't figured out where to publish this or how to tell the story, because it's a one fact piece of information, is that about half of the cup equivalents of vegetables are purchased out of the produce section. So so they may in fact be avoiding the produce section. They may still be avoiding the produce section and purchasing their vegetables elsewhere.
So interesting. Yeah, because where does the variation come from is sort of like the root question here. And right. There could be a lot of power in terms of like looking at marketing related questions about if we know where households with a type 2 diabetic or without type 2 diabetes, where they're buying their vegetables and what's driving the variation in these produce categories. And random weight, yeah, I see this too. That's another side of this, limitations.
Chris, do you want to comment on Kakoli's question?
I recall that they are under measured, I believe, in the both consumer network and Info Scan data set, if I recall correctly.
Sorry.
Are they or not?
No, what it is that in the consumer network, we can't measure random weights because we don't get, we don't have a quantity. So we can't include them in our calculation of HEI. So that's there. Fruits and vegetables in general are underreported, as Armin put in the chat. In Info Scan, we have everything that goes over the scanner. But of course, the studies that we're conducting are using the consumer network. And about half, when I was playing this and evaluating it in 2013 data, about half of the expenditures, because we do have expenditure data for the consumer network on random weight produce, about half of the expenditures are random weight. And random weight is stuff that you pick off the pile and put into a plastic bag yourself, or the store packages it. So it doesn't have a barcode.
Yeah, the whole random, I have this data set that, and I'm writing a note down, see if I can, I'm curious, I want to connect with Andy and Chris too about this other one. We do have random weight products, but we would need a lot more data. So another day, but, and I'll sidebar with you on that. I do want to also take a few minutes to talk about, this is about linking data. And for researchers on the line or who will eventually watch this, if Alana, Chris, and Armin, if you could spend maybe a minute just talking about like your approach to linking data, and you did touch on this a little bit, but sort of like what are the tools that you need to lay out in front of you before you actually execute on linking the data? What do you need to have at the ready? Especially for some of the junior folks that are going to be listening in, who are going to be beginning their own, research projects that are going to bring together maybe 2, 3, 4 multiple disparate data sets. Do you have a tip or a recommendation, a specific tool maybe that you use that you might offer to those junior researchers as they're about to embark on their data linking expeditions? Alana, we'll start with you.
I would just make sure I know for the Food Access Research Atlas, for our store data, we use 2 different data sets. One's from TD Links, which is a proprietary data set, store directory, and then another directory called STARS, which has a list of stores that are authorized to accept SNAP benefits. And we merge those 2 data sets together based on the address of the locations of the stores. But just be sure that, when you are merging both of those any data sets together, that to recheck them together, because sometimes I notice with merging both of those store sets together, that there could possibly be duplicates because one store set may be off just one number. And so it makes a difference. So you don't want to have duplicates in your store data set. Also, what's really helpful for the Food Environment Atlas, because we get data from, like I said, we have over 280 indicators, and most of those come from outside sources outside of ERS. And what's really helpful is that some of those store data does have FIPS codes. And so we are able, county FIPS or census tract FIPS, so we are able to link those data sets directly together without having, much fuss or any errors or mistakes like that.
So regarding linking scanner data directly with USDA nutrition data, we do have 3 tools that do that or assist users in doing that. I went over a few of them. So we had the PPC tool, also known as the HEI tool, the ingredient tool, and the price tool. And those show users how to directly extract the Iri scanner data and how to join that with the USDA nutrition data sets. I guess to go into more detail on that, the purchase to play crosswalk directly provides a link from a UPC to what we call an ensemble code, which many of you might just know as food codes from NHANES or from USDA nutrition data sets.
I would also mention two general comments. I think first is understanding what the aggregation levels are of different data sets. For example, in the IRI consumer network data, we have household level, which is household level data, and we have different geographic indicators. And some data sets are census level, others are county level. So understanding what the geographic aggregation is very important, and also the follow-up interpretation of the results based on the differences in geographic aggregations of different data sets. And one thing that I learned during this process is that some of the FIPS codes, be it county or census tract level, have changed over the years, and different data sets may have used the old or the new FIPS codes. And as a result, if you're not careful, you may lose some data. So you need to make sure that the counties, particularly, to make sure that you have either only old or only new and FIPS codes, and make sure that you're capturing all of the data and not losing anything just because of the changed FIPS codes in different data sets.
Those are some really great points. Yeah, Alana, you touched on understanding the data generating process for some of those data sets like TD links and stars, and what's how they're collected, some of the flaws and limitations, and just in the reporting of things. And so it's really important to have a careful eye to that. And then Chris, you mentioned these food codes, and in linking data, is it a one-to-one match or is it a one-to-many match? And there are a lot of really important considerations when you think about just the unit of analysis in terms of linking data. And then Armin talking about just the data that's collected year over year and that's reliant itself, like that itself is using information that might change year over year, like FIPS codes. And when a lot of us are using American Community Survey data, which has important demographics, if a FIPS code changes from one year to the next, then we have to recode all the FIPS to look at doing any sort of longitudinal analysis. So really, really good points and excellent tips. Does anyone else, before I kind of wrap us up, if anyone else wants to say anything on the call before we have our little wrap up, please chime in.
Yeah, I'll just clarify on the purchase to play crosswalk, it is a many to one match. So you have many UPCs matched to a single food code.
I'm going to pull up a couple more slides here. Okay, so I want to conclude with some food for thought. And I think all of us kind of touched on, or all of you touched on some of these considerations, is that, we did spend a lot of time talking about data linkages, but certainly they're not going to be the panacea, if you will. I mean, sometimes research questions that we want to answer are going to require doing, collecting our own data. But I hope that the audience on the call understands that there's so much power in data linkages, and that there are some really amazing research here that's been published because of them. Certainly, also, as was brought up on the call, that joining data sets, they may bring their own share of data quality issues. We have to understand, again, the data generating process, who's collecting the data. The data that are being collected might be collected for different purposes. Like Chris mentioned, IRI and Nielsen, they're collecting this data for market research, but we ag economists are using it for policy analysis. Sometimes fields within data sets are not standardized, and there's different ways of inputting similar information. Sampling strategies might differ. Something else might generate some data quality issues if we don't understand how two disparate data sets are being collected, and therefore it just calls to mind or encourages us to be more cognizant of those potential issues. And then these are just some questions to consider, when we're linking data, especially if a unique identifier doesn't exist between two data sets. If we link data and some observations are dropped, does it potentially impact the representativeness of a sampled population? And then if we have false matches or issues like Alana brought up in terms of thinking about duplicates, what is our tolerance for that? So that, and then kind of as a final plug, this is, we're all here trying to, we have similar missions, and so we're all here to support everybody. So reach out to any of us here on the call, and I'm sure we'll all help in one way, shape, or form. And with the last, I guess, couple of minutes here, I want to make a plug for other research that we're doing. I'm doing at Arizona State University with some folks at Ohio State, Allegheny, Virginia Tech, and the USDA. So one of the things that I myself as a researcher have encountered throughout my career thus far is that I really do enjoy working with data and understanding understanding the landscape of different data products. And when I work with a lot of these different data sets that have been collected by other agencies, I notice that some are better than others. Some, there's obviously going to be trade-offs, but some of the most interesting questions require that I link two or more data sets together. I mean, I have one paper that I worked on and I linked 17 data sets. So, I mean, I do have some kind of track record here, and maybe exposing myself as a bit of a data junkie. However, I want to show something here that has inspired me and some colleagues to create something that I think is going to be a very helpful tool for researchers and especially junior scholars as they begin to embark on this very exciting career path ahead of them. So here I'm just showing you a 2D axis. On the x-axis, it's low to high in terms of which data sets or data aggregators provide some kind of instruction about what they offer in terms of how to link it with other data sets. And then on the y-axis from low to high, I'm calling this an informational access, really meaning like what's in the data, what variables can be used from these different data sets, and then how to access it. So again, like instructional is going to be things like how to mechanically link data sets, and informational is just going to be what's inside the data when you look at it. So it's a bit of an extensive and intensive view. And there are a number of different data sets that exist outside of the Economic Research Service through the Fed, through different, I like to think the food systems dashboard is a consortium of universities. There's another health survey that's collected internationally. There's Harvard puts together their own data products, USDA Ag Commons. There's all these different data aggregators out there. But there's this opportunity for us moving forward to think about ways of harmonizing these data dictionaries across data sources that are collected by different agencies so that we can have a more an easier way or a more systematic way of being able to link data sets. Because partially what's happening with data linkages is really we need to understand if one data product, it calls a variable, a geographic variable FIPS code, but the other one calls it a county code, we need to know that that's actually saying the same thing. It's communicating the same thing. So for researchers who are really trying to understand that they can actually link this, we need a decoder. We need a decoder. So that's where we're starting from. That's our starting point. And so what we started to create is this project called Data Integration in Food and Agriculture. And it's an online platform that's dedicated to answering some of the most pressing questions in food and agriculture, because we're a team of agricultural economists. And what we are providing to users is four major things: helping users identify appropriate data, provide best practices for using various data products, overcome challenges associated with data quality issues, and then ultimately promote replicability of data-driven research. And what you're looking at here is it's a very beta screenshot of what a data card would look like. So we would have information about, this is completely mocked up. This is not, there's no URL yet, but this is just a data card that we would show to a user who's just looking at understanding what data sets exist that might record food acquisition and purchases. And we would have information about whether it's open access, which types of publications have used this data. We would be able to provide curated link guides, which would be informed by our data stewards. And then we have information, these data DNA cards about, so you can compare, ultimately we'll build in features that you can compare two different data products. And then look here down below about how the data have been linked across using these different variables. So I've included a little URL down here if you're interested in learning more about connecting with us, being involved in the project in some way. And ultimately, that's going to be a tool that we provide to researchers in the coming, hopefully, year or two. It's a very complex project, but we're really, really excited about it. And Andy, who's on the call, is one of our key supporters in this. So that is my little plug. Thanks for listening. And I think it fits really well with today's session, given that we're all really hungry to do some really great work in public health and nutrition. So thank you. Questions, if anybody has any.
This is great, Lauren. Really looking forward to having the final project available to researchers. This will be super helpful. And also thanks a lot for moderating the session.
My pleasure.
Yes, thank you, Lauren.
Yeah, thank you very much.
Absolutely.
We don't have any more live participants, but hopefully somebody will watch the recording.
Hopefully.
Um,
At least we can, yeah, we did a nice presentation here. You all did great. And I am glad I got to see some of your faces who I haven't seen yet. And also Armin, see you again. Good to connect.
I will send out a Teams link so we can discuss next steps, like right now, because this meeting is recorded.
Yeah, sounds great.
I'll
Well,
turn it up.
email and yeah, I'd love to host you all at the ASU seminars at some point in the future too. Cool. Bye everybody. That's
All
all
right,
right. See ya.
Bye.